Hello, everyone. Welcome to the next edition to our series on natural medicine. I have the honor of speaking to John Campbell. And last time we talked about flaxseed, and John presented a very interesting study, natural medicine study. And that's what this is all about, talking about everyday things that we can do away from the medical industrial complex that can really help with health, but aren't necessarily advertised out there, not blasted across your screen. So to emphasize again, when we do these sessions, I don't know what John's going to talk about, and John doesn't know what I'm going to talk about, and I will confirm that now with John.
Absolutely. It's your turn, Sunil. I'm pleased about that. So it seemed rather strange to come and do a video with no preparation whatsoever. So I am just as curious as everyone viewing and just as ignorant as to what you're going to talk about. So I'm bursting with curiosity to see what it's going to be today.
Okay. Well, yeah, I am ready to go with my natural medicine and a very interesting study behind it as well. And I am going to talk today about, drum roll, blueberries. Can you see
this? Love them.
This bowl of blueberries. And those
fantastic.
Those people who have followed me for some time know that I'm a huge fan, but I haven't necessarily presented to you some of the amazing studies out there. So these are available across most Western countries, I believe. I know they're widely available in the UK, they're available in the US. But what's the evidence behind them, and why are people like me so keen on them? So I'm going to present now, and I'm going to go through this study bit by bit, and then I'll stop at certain sections. John asked me some questions. So Excellent. Here we have it. This was published in the American Nutrition Journal, Clinical Nutrition, and it's original research. And the title is Wild Blueberry Polyphenols Can Improve Vascular Function and Cognitive Performance in Healthy Older Individuals, a double-blind, randomized control trial. Your first thoughts, John?
Well, interesting that they're wild blueberries. I'm not quite sure what the availability is of that, but obviously wild things would be, well, you haven't got the artificial chemicals and the fertilizers and things like that. So that's attractive. Not quite sure how available it would be. Might be challenging to grow it on my own, to try and grow it personally. The fact that it's a randomized controlled trial is certainly interesting. I mean, this has been considered to be the gold standard of research for all my career, really. We know that everything can't be researched in terms of RCTs, but where it can, it's good because we can compare, presumably, people getting blueberries and people not getting blueberries. Is that the approach they took, Sunil?
Absolutely. It is the approach that they took. And many of these benefits, I'm sure, could apply to other types of blueberries, wild or not, and also other berries. But let's focus on this study because they did use wild, presumably organic blueberries. So this study, it has a number of researchers listed, and it was done in London. Proud of that, my city of birth, with this study. So it is a study which is from a Western country, and as we mentioned last time, we don't always get these studies from Western countries. They tend to come from other parts of the world. So it's good to see this. And I'll talk at the end about the funding and whether there were any conflicts. So let's get right into this then. So I'm going to start with the introduction here. What they talk about: the risk of developing both cardiovascular and neurodegenerative diseases increases with aging. I know this is a huge concern. All of us will have somebody, either ourselves or a family member, who has this concern. So it's important. What can we do naturally to reduce the risk of cardiovascular and neurodegenerative decline with age? So adults aged 60 and over have a particularly high increased rate of cognitive decline. That goes without saying. And in parallel, endothelial function is known to decrease with increasing age, and endothelial dysfunction is associated with many diseases, including cardiovascular degeneration. This study does talk a lot about endothelial function. We'll stop right there. And John, endothelium, I know you've talked about this before, but this is just such an important part of the body and organ to focus on.
I mean, the way I would understand this, Sunil, is that blood vessels basically have three layers. There's an outer fibrous layer, there's a middle muscular layer, and the internal layer is the vascular endothelium.
Exactly.
And this is typical, just one squamous cell thick. It's very thin, but it's a very physiologically active layer. And this will line the inside chambers of the heart. It will line all of the arteries. It will line all of the veins. And when you get down to the capillaries, the very small vessels, the outer two layers are lost, and all you're left with is this vascular endothelium. And of course, this is what the blood is in direct contact with, Sunil, isn't it? You've got direct contact between the blood and this vascular endothelium. And we know that there's a lot of diseases associated with the vascular endothelium. And things I don't fully understand, actually, the vascular endothelium releases various cytokines that affect things like vascular tone and the fluidity of the blood. So it's an absolutely vital area of physiology. And given the choice, I would really prefer to have a healthy vascular endothelium.
Yeah, those words are going to come straight out of a medical textbook. I'm sure you do have a very healthy endothelium, John. And yeah, this can't be
so.
A healthy endothelium means a healthy body. Your blood flow is going to be good, less risk of clotting, degeneration. So I'll talk more about that in a second. So they also want to focus on maintaining a healthy gut microbiome, which is a huge topic in itself. So what did they do for this study in London? So they used 61 healthy older adults. They were recruited from the London area, and it's important to note they were healthy at baseline, between 65 and 80, with a BMI of between 18 to 35. I would argue that a BMI above 30 is not healthy, but they didn't use that as a marker of being healthy. And they basically had exclusion criteria, so people with severe vascular disease already, people with coronary artery disease, people with high blood pressure, diabetes, they were excluded. They wanted to see if they could bring about any more benefits from blueberry consumption. We can talk later about what the potential is for people with disease as well. So this study was a randomized, double-blinded, placebo-controlled, parallel design study in those 61 healthy older individuals to investigate the effects of daily wild blueberry consumption. They talk a lot about polyphenols. These are the antioxidants in blueberries. So it's a polyphenol consumption on vascular and cognitive function. So they're looking specifically at, if you consume blueberry, how will it affect your cognition and how will it affect your vascular function mediated by your endothelial function? So what did they actually receive? What were these products? So participants received 26 grams of freeze-dried wild blueberry powder, which is equivalent to 178 grams of fresh wild blueberries. So to put that into context, a cup is around 160 grams, so around a cup of blueberries every day, equivalent of that, okay? And then what they did was they looked at some primary outcomes, so endothelial function measured by flow-mediated vasodilation. They used various ultrasound techniques. I won't get into too much detail. I want to give you that overview rather than go to exactly how they measured. But then for cognition, they used an auditory verbal learning task and specific tasks measuring recall, okay? Secondary outcomes were arterial stiffness, measured by carotid femoral pulse wave velocity and augmentation index. And then they talk about other ultrasound measurements they used, including Dopplers and blood counts as secondary outcomes, including liver function, kidney function, and so on and so forth. They looked at the dietary backgrounds of people, made sure, as any good study does, that the two groups were very similar. And they had a placebo intervention as well, which was matched in appearance, taste, and macronutrients. And they tried coloring as well, so that it was a very close placebo, but didn't contain the active components of blueberries. So I'm going to stop right there because they go into a lot of detail about how they're measuring cognitive function, etc. And then they actually did one very interesting thing, is they proved that the people were consuming blueberries by looking at the urinary polyphenol metabolites. So they could tell that the people who were given blueberries were actually consuming them and confirmed it that way. And then they used statistics, etc. Before I get to the results of this study, John, your thoughts?
Yeah, it sounds like a very thorough study. They're making sure they've got two groups. Interesting to me here that this is very much a study on health. This is healthy people who want to remain healthy not people who've got a disease already, because of course prevention is always better than cure. They're doing a lot of studies on the vascular system, which is good, some quite sophisticated ones. And of course, there's this old saying in medicine, Sunil, that you'll have heard. The saying is, you're as fit as your arteries. So if you've got fit arteries, you're probably fairly good. Now, I used to joke to my students, rather macabre joke, but I used to say you're as fit as your arteries unless you've got cancer. But there's actually quite a lot of truth in that, because arterial disease and cancer is, of course, two main causes of death in our Western civilization. They're also looking at cognitive effects. What interests me here is we don't know if there's any benefits yet, but the cognitive effects, are they going to be independent, direct effect of the polyphenols on the brain, or is it because the brain's got a better blood supply? Probably a bit of both. So quite interesting dynamics going on here, but we're dealing with such massive problems. We've got so much cardiovascular disease, so much neurodegenerative disease. In fact, even short of neurodegenerative disease, what you might call, I don't know, dotage, old age sentience, where people aren't just as crisp as they once were, and anything that improves cognitive function, because we want to live as well as we can up until the day we die. We want to maximize health for as long as we can in as many people as we can. And the other thing that strikes me about these studies is that if we wanted to, when we talked about blueberries there, my mind was just buzzing because I have an allotment and I get distracted with these thoughts. We could grow millions of tons if we wanted to.
Oh, yeah.
We really could. And the other thing that struck me as being quite clever, and this was also in the flaxseed study where they substituted wheat for flaxseed. Here they're substituting something that looks and tastes the same. So the placebo effect, which as we both know is remarkably strong, appears to be fully accounted for. And I'm very curious about the results now, Sunil.
Yeah, so let's get right onto the results. What did they find after weeks of studying these people?
How many weeks was it? Sorry.
So they did a total, I'll confirm that for you. They did a total here of, it looks like it was either 6 to 12 weeks. Let me confirm the exact amount here. Yep, I'll do that because I think they may have gone on a bit longer than they expected here. But they did several weeks at least.
Yeah.
And then actually most people, they went up to 12 weeks. So yeah.
Okay, 6 to 12 up to 3.
Yeah,
which isn't that long, really.
Yeah.
3 months.
Exactly, yeah. Not that long at all.
Yeah.
Okay, so talk about the baseline characteristics here. And they say that they were similar in both groups, and they made sure that they fit the criteria. These were healthier older adults. And firstly, what they found was the wild blueberry intervention improved vascular function. So the primary outcome was differences in the flow rate of the endothelium. They used, it appears, a brachial artery measurement on that. And they found that it was significantly higher flow in the wild blueberry group compared to the placebo group after the 12 weeks, okay, by 0.86%, so almost 1%, which is a lot in just a few weeks with a natural intervention. Then they also found there was a significant reduction in 24-hour systolic blood pressure, 0.6 millimeters, which may not sound like a lot, but it's a lot for a natural intervention in already healthy people. It decreased in already healthy people. They didn't find significant differences in some of the other secondary outcomes, so they were the main findings. And your thoughts, and then I'll tell you what they found about the cognitive function.
It does make sense, because if the blood vessels are more dilated, then the blood pressure is going to be lower, because blood pressure is determined partly by what we call peripheral resistance. It's cardiac output and peripheral resistance.
Exactly.
And people might be familiar with the brachial artery if they've ever worked in healthcare, because that's the one where we measure blood pressure.
Yeah.
It's the one just at the top, just in the fold of your elbow there. So it's just there, the main artery taking blood into the lower part of the arm, which is good. It's easy to access that. And of course, the point is, if there's an increased blood supply in the brachial artery, we wouldn't expect that just to be in the brachial artery. This is representing arteries all over the place. And even though the benefit there is not profound. It is measurable there because they've used statistics to get that result, which is encouraging.
Absolutely. Yeah. So here's a part I liked even more, because I've seen a lot of studies on animals, particularly mice and blueberries, but these were human beings.
Yep.
So while blueberry intervention improved aspects of cognitive function, significant differences in immediate word recall were seen following the wild blueberry treatment for 12 weeks. And they did their own measurement, they had their own scale, and it reached significance. So they were recalling words. So again, you have to take these numbers into context, but in a healthy group over a short time, it's a lot. So basically, the blueberry treated participants were recalling almost 6 words, where placebo were recalling closer to 5.
Well, that's quite a big percentage difference. Yeah. And of course,
20%.
We can all relate to this. And I'm always forgetting the word for things, or getting things confused, like asking for tangerines when I want apricots and things like that. But this is really important, because we know that one of the very early symptoms of dementia being a progressive, irreversible impairment of intellectual function, is loss of memory for recent events. As the mind grows old, it remembers not yesterday, is a word from an ancient Egyptian papyri, and that remains true today. And given that this is an effect that's so occurring in 2 to 3 months, that's interesting, and such a quick effect is actually a little bit surprising as well.
Yep, in only 3 months. That's it, with this small intervention.
Yeah.
Okay. And again, we said this last time, but if we had a lot of these study results with an expensive drug, it would be blasted across the mainstream media.
Yep.
Money would be changing hands. We know how the system works. But hey, this study was done 10 years ago. Who's more than 10 years ago? Who's heard about it?
Absolutely. Yeah. And if there was a lot of money involved, I'm sure the statistics could be presented in an appealing, interesting way.
Yeah, 20% improvement in memory right there. That's what they would present it as. But
yes, they would, but they could also do the statistics to make it look more appealing.
That's right.
Where it sounds like this study is presenting fairly objective statistics. We could have... there's all sorts of tricks that companies could use to make this look like a more profound effect. So this sounds quite honest. And the other thing that I found really useful about this, actually, is fresh blueberries, of course, can be difficult, but it looks like the frozen product is as effective. So you can buy frozen blueberries relatively cheaply, take them home and make them up into a bit of a smoothie. And personally, I like them in my porridge, although I'm trying to cut down on carbs. But blueberries and flax seeds in porridge is actually quite nice.
Yeah, so a good combo. Yeah, and we'll talk more in a little bit about how we can eat them. So then they talked about the plasma and urinary metabolites of polyphenols. Right. So they confirmed that they had been taking the blueberries. I like that they did that. They talked about the microbiome a bit. They didn't find very significant differences there in the microbiome. And basically, they've got lots of these complicated graphs here, which do show their findings and sort of emphasize their point. But I'm going to get straight to the discussion here, because this is so interesting. To our knowledge, this is the first study to investigate the impact of blueberry consumption on cognitive and cardiovascular function simultaneously in a group of healthy older adults. We observed that 12 weeks daily of wild blueberry consumption improved the vascular flow, by 0.85% and ambulatory systolic blood pressure by 3.6, almost 4 points, with respect to the control, whereas no effects were found in arterial stiffness and blood lipids. This is consistent with a previous study in younger adults. They talk about that. And then to emphasize, they basically are saying that their conclusion, daily intake of this particular substance, of course it was a powder, but it would be the same if you were consuming the actual blueberry, equivalent to 178 grams fresh weight, improves vascular and cognitive function and does significantly decrease systolic blood pressure in healthy older individuals. These are all over 60. This suggests that the polyphenols may reduce future cardiovascular risk in an older population and may improve episodic memory processes and executive functioning in older adults. Absolutely amazing. And some of you may be asking, well, who funded this? Because I talk about this a lot in my videos, and it's important to talk about any conflicts of interest. So basically, there was a grant from the Wild Blueberry Association. However, this is what I like about these natural studies. They had absolutely no input into the design, implementation, or analysis of the study. So that people understand, they might say, well, why are Blueberries funding it? Somebody has to fund a study. It's very difficult to get money otherwise. So they funded it, but they had zero input in the study design. And conflicts of interest, usually, I highlighted this part here, usually with big pharma studies, you will see a number of conflict speeches. Not one of the authors had any conflicts of interest or desire to promote Blueberries, etc. So to me, this is just about as clean of a study that you can get.
And who knows, some studies in some journals may even be ghost written by vested interests.
Yeah.
Who knows? That's possible. Disease prevention, great. Arterial stiffness, there's no reduction in that. That doesn't surprise me, Sunil, actually, because arterial stiffness could be related to things like calcification, maybe some fibrosis. These are longer term things that would take more than 3 months to reduce that.
Yeah.
But we're getting that instant physiological vasodilatory effect. Vasodilatory effect is good for two reasons. One, it's lowering blood pressure. That means it's reducing cardiac resistance. The heart doesn't have to work as hard to pump the blood into the vascular system. So that's going to give some protection against things like heart failure, left ventricular enlargement, so-called left ventricular hypertrophy. But as well as that, it's going to increase the blood flow to the organs. And of course, that's what you want. You want good blood flow to the functional organs, good blood flow to the liver, to the kidneys, to the lungs, to the brain. Everywhere that's going to be good. That's going to improve end tissue oxygenation and nutrition, and hopefully help to remove the waste products more effectively as well. So all sounds really positive. And the other thing that would be interesting, I suspect there would be effects on the microbiome if the follow-up was longer.
Agree. 12 weeks is not long enough. Yeah.
It's probably not long enough. There might be some of it. Depends what bugs you look for, of course. I mean, in the microbiome, you've got so many thousands of organisms, you can't look for them all. So if they chose different ones, maybe they would have found a change. Interesting question. Let's come back in 5 years' time, 10 years' time. Do you think there may be a reduction in different forms of cancer, Sunil?
I would not be surprised if they were, according to everything I know about blueberries and what's in them, the polyphenols and anthocyanins. So to get into the science of it, which is why I've been a fan for so long.
Go for it.
Blueberries have one of the highest antioxidant contents of anything known in our food environment. So one serving of blueberries can contain more antioxidants than 5 whole servings of fruits and vegetables. So to recap, what are antioxidants? Well, they're substances that work against free radicals. Free radicals are being produced all the time in our body. They are implicated in degeneration, inflammation, and also aging. So anything you can have to fight those free radicals, antioxidants will be of help. So the science behind antioxidants and their anti-inflammation effects, I'm sure would extrapolate to other conditions. I've seen lots of other studies as well on specific diseases and organ systems, and it's all based on the effects of these polyphenols and anthocyanins.
I mean, we normally think of oxygen, of course, as being important and essential to life, which of course it is.
Yeah.
But really, the only part of the cell that uses oxygen is the mitochondria. In other parts of the cell, oxygen can actually add itself into other molecules. There can be oxygenation events. Yeah. And that will actually change the nature of those molecules. So instead of a molecule, it will be a molecule plus oxygen. So, for example, everyone's familiar with iron, which is fine. We can build bridges out of it. But iron plus oxygen equals iron oxide, which is rust. And we can also oxidize the genetic material in the cell, of course. If we oxidize the DNA, then that actually could form a type of mutation because we've got DNA oxide rather than DNA, putting it in very basic terms, which is about the level of my understanding. And of course, when you change the nature of the DNA, we have a word for that, and that word is mutation.
Yeah, absolutely.
And the risk of cancer is there. And the polyphenols, these antioxidant chemicals, often associated with the colours. I don't know too much about botany, but I suspect there could be, probably a dozen polyphenols or several dozen polyphenols, slightly different related molecules.
Oh, yeah, of course. Yeah. And different berries are also high in polyphenols and anthocyanins. Blueberries are the ones which are believed to be the most. And to give you some practical tips, I mean, if you don't already eat blueberries, how can you eat them? I personally consider blueberries to be my daily medicine. Knock on wood, I never want to be on any prescription. So I try to do all these things every day. I eat blueberries and have for many years every single day. I'll often grab a couple of handfuls, have them alone. I find them delicious. So again, 1 cup, approximately, it would be about 160 grams. And it's about 80 to 90 calories. It has a lower glycemic index. It's also high in vitamin C, got a decent amount of fiber in it as well. So you could have it alone. You can put it on a salad. You can put it in a porridge, like John just alluded to. I found it so funny, by the way, after our last talk, when you mentioned porridge, a lot of Americans replied they don't know what porridge is. It's a very British word.
Oh, we're so English, Sunil, aren't we? But you've no excuse. You've been there for a few years now.
I've eaten many porridges. You might want to tell Americans what porridge is.
It is, well, mine is a combination of oats, and you can make it up with water or milk. I normally put in some oats, some milk, bring it to the boil, and that's basically it. So it's oatmeal, I think. Is it oatmeal you would describe it as in the States?
Yeah, it would be similar to that.
Yeah. So I'm reminded of a few things there. Eating a rainbow, eating a wide spectrum of colours, because then we're getting a wide spectrum of polyphenols. And the darker something's coloured, in my simplistic way of looking at this, the higher the proportion of polyphenols. So blueberries, blackberries, dark colour, probably got quite a high amount. So other things like beetroot, for example, also dark colours. So again, would contain polyphenols. Good that there is some sugar in blueberries, as you mentioned, but when the sugar's associated with fibre, then it's absorbed more slowly because the sugar is in the fibre, and a lot of the sugar is inside the cells, which are somewhat fibrous. So the sugar is released much more slowly, which gives you a much lower glycemic index. And also, if you eat this, for example, if you had them for a pudding or a sweet after a meal, and if that meal contained fat, then again, the presence of fat and a carbohydrate in the stomach together is also going to reduce the glycemic index. So 2 reasons why that's good. Vitamin C, of course, is vitally important. I'm always a bit concerned. These were wild ones and organic ones, but the ones you get from the supermarket, I'm always a bit concerned about what's been added to them and the quality of the soil, because the nutrition profile will vary depending somewhat on the quality of the soil. And I always wash them. I don't know if that makes a difference, but I'll always, when I buy a fruit like blueberries, I'll always just soak it in water for 10-15 minutes before I eat it. It probably washes a few bits and bobs off. But there's great hope here, of course, because we believe that Bobby Kennedy is going to start really getting a grip on agricultural chemicals in the United States, and hopefully these will get much more healthy. But of course, if you can source organic ones, or talk to your friendly local neighbourhood grower, or even think about growing some yourself, so much the better. But in the UK, things are pretty safe, but getting safer in the United States, I believe, in terms of agricultural chemicals as well. So, and not only that, if you eat things like blueberries and plants, then you haven't got the bioamplification effect. So if you're eating animals that are eating a product, then they'll concentrate any toxins in their tissue. So even if there are some toxins in the environment, then it's much better to eat primary producers like plants rather than things that have eaten plants. As a general principle, I think that's true in terms of bioamplification. That's why some fish can have more mercury in it, and because it gets concentrated from the plankton to the little fish, to the bigger fish that eat the little fish. So no, it sounds great. In fact, you've whetted my appetite there. I quite fancy some now. I might go.
Blueberries, fantastic, and that's a great point there, John, about making sure they're clean. Now, I buy the organic wild blueberries. I understand that cost is a real issue for many people. I would still say you can't go wrong with getting blueberries, even if they're not organic. Frozen is also a good option. They really do maintain as long as they're frozen quickly, as we've already talked about. And just so versatile. Actually, one of my favorites, I have to say this as a snack, is a good Greek yogurt mixed with blueberries and nuts like almonds or walnuts. And I will have that as a snack. It's also high in protein. So there's a tip for you if you haven't tried that. And
Greek yogurt's fairly high in fat, so that would further lower the glycemic index of any sugars that you were eating.
Exactly.
Yeah, it's a natural product. I think for most people, the practical way ahead here, Sunil, may well be frozen. Because fresh blueberries are relatively expensive, but you can get packs of frozen fruits really quite cheaply, and you can blend them, you can put them in smoothies, you can just use your culinary imagination and eat them in different ways. So I think that's an important point to remember in terms of fruit and vegetables. If fresh ones are not available, then frozen, because most of these industrial freezing procedures are really remarkably quick. You get virtually all of the nutrients of the fresh product. So don't be afraid to use frozen products.
Yeah, natural is always best. Yeah, I know some people that even have blueberry supplements. I think blueberries are far better. Anything is always going to be better if you can, but then if you can't, at least get some of these compounds into you, which could be in a concentrated form.
Yep. No, I agree. That sounds excellent, and good to know that there's actual physiology there being demonstrated. So we've got the physiological effect from the research, but we've also got this Bradford Hill idea that there's plausible mechanisms of action.
Exactly, and yeah, look at this. I'm probably going to eat
yeah.
Demonstrate it live.
I could do with one.
Absolutely delicious. Got these. So please do consider that if it is something that you want to try, as long as you have no problem. Most people would have no problem with consuming blueberries. And I really want to impart on you, and I'm sure I speak for John as well, that this is about all of the wonderful natural things that are around us. Is something magically going to make you better or cure you? No, but it's an accumulation of all these things that are going to help. And just think about this for a moment. This study that I presented to you was in healthy people between 60 and 80, already by virtue of age, a higher risk group. But if you can see these improvements in healthy people, I'm sure you could extrapolate that out to sick people as well, maybe even more of an effect, because they got diseased, inflamed tissue, and you're immediately putting something in your body that could help to counteract that.
And as well as that, we need to learn so much more about the precise physiology of this, don't we? I mean, if we understood how these polyphenols were working in more detail, that would actually teach us more about how the body works, because we actually don't know too much about how the body works. A lot of what we work on is fairly simplified models. I'm not too sure what life is. As fundamental as that, it's hard to define what life is. You can describe what it does, but it's complicated. It works on so many different biochemical pathways, and we are designed or evolved to live in ecosystems.
Yeah.
And these ecosystems generate really quite... I mean, if you just imagine that we gave the best biochemist in the world a brief and says, right, here you go, mate, go and make me a blueberry. I mean, it would just be totally impossible. The sheer beautiful complexity in that.
Lovely.
It's just designed to interact with the amazing, beautiful complexity in us. And that's what we need to get back to, this natural polymolecular approach. I think I've just made that word up. But whereas in pharmacy, it's very much one molecule that does one thing. Now, the argument, of course, for that is, well, that's good because, there's one molecule, there's one variable, exactly what the dose is. All true. But it's only going to probably work on one pathway in the body, whereas we have multiple pathways in all cells of the body going on all at the same time, interacting with each other, with what you might call emergent properties. In a sense, life is that emergent property.
Yeah.
It's what comes out of this milieu of complex but superbly ordered and regulated biochemistry. And it's not surprising that you need an equally complex food and series of foods to make that work in an optimum way, combined with things like the microbiome. We're only just learning how complicated and beautiful these systems are. But in a sense, we don't need to know, because the philosophy here we're describing is we believe in these natural things promoting health using natural methods. Now, I've been giving out drugs since I was 18, and I'm sure you've been giving out drugs all your career as well. These are sometimes necessary. Of course, we are not anti-drug. We are clinicians. It's what we do. But let's promote health and promote these natural products and a diversity of natural products as part of a return to a more natural lifestyle as far as possible.
Absolutely. And what you said there about it's very difficult to better nature, really tough to do that. It's already been created, whatever your thoughts are behind how something's been created. Clearly, there's an evolutionary process which has resulted in something which is as perfect as can be in the environment that it's in. And my philosophy is, personally, exhaust everything natural if we can. And then me as a doctor, I'm there for you if anything goes wrong. But my whole philosophy is medicine should be temporary. And this is what bugs me a lot about the modern medical paradigm is we've gone from, oh, you have a problem, I'm a doctor, let me fix you, bye-bye, to, oh, here, I'm a doctor, here you go, product for life. I don't like that. It doesn't sit well with me, that because I don't think that that's good for the human body. Medicine should be temporary if possible. Everything else should be natural.
And as a general principle, it's not always true, but, medicine and surgery are for the sick.
Exactly.
Healthy people opting for surgical procedures or healthy people opting for drug protocols. Yes, sometimes it's necessary to maintain health. We know that, but it doesn't sit easy, and unless there's some specific medical reason for that, natural methods to maintain health is best. And I think I'll just say one more thing, Sunil, if you don't mind. We got a few comments last time, and in the United Kingdom this isn't an issue, but in America it is, this evolution creation dichotomy that some people see. Now, if in the UK people just aren't interested. If you go into a church, for example, in the UK, and you start saying, well, where are you on the evolution creation continuum? They'll say, well, what are you talking about? but in the States, it is an issue. And this natural approach we're taking, to me, sits equally comfortably with both. So if you believe, for example, in a young earth creation, then God has put everything there all ready for us to interact with. It fits in perfectly with the creation perspective. If you believe that we evolved from the last universal common ancestor 3.8 billion years ago, this fits equally well because I've had time to adapt to that situation.
Yeah.
Or if you believe more like me that there's a theistic evolution, that there's been ongoing change with creative intervals, in that it sits equally comfortably. So we'll still probably get some angry comments in the comments, but to me it fits equally comfortably with all of these theological, philosophical belief structures.
Absolutely. And there's so many out there, whether we're even talking about something different like the yin and yang of life. Like there will always be forces pushing you in a certain direction. There'll be forces trying to push you to the good, to the bad, balance, back and forth. Pendulum swings back and forth. I think we're at a particularly bad time right now where we've completely forgotten our natural roots. And ultimately, this is all reflected in statistics. You can argue what we're talking about, but you can't argue with statistics that people are getting sicker. You can't argue with the fact that how many people are going to eat blueberries and have side effects compared to people who have pills and injections and have side effects. I mean, the evidence is all around us in the statistics behind what is a better approach initially versus what is a not so good approach.
Yep. I mean, I suppose you might get a few people that are allergic to blueberries. It's possible.
Possible, but very few.
I imagine part of the blood pressure lowering effect as well maybe be the potassium that all fruits contain. And people with renal failure, of course, shouldn't take potassium. Apart from that, I can't think of any reason not to eat fruit. Some people with diabetes might have to be careful about the sugar content, but you've already pointed out that it's a relatively low sugar carbohydrate content in blueberries anyway. There's just no reason not to eat these natural products. It's just such an obvious way to go, as long as people can afford it and can source them at reasonable prices. Would be the only criteria, and enjoy it. Yeah. There's no pleasure in taking a pill.
Yeah,
there's no fun, but something like blueberries, they're a nice colour, they look attractive, they smell nice and fresh. It's just it's just the way we should be. We're designed to live in fields, not in fields and forests, not in cities and skyscrapers. Having said that, we have to live in those, but if we can get back to a more natural approach to life, then that is, well, basically we've no alternative. We're human beings, and every day, I'm not in direct clinical practice now, but every day you'll be seeing people suffering. And when we say suffering, we mean people that are in mental and physical agony.
Yeah.
As a result of lifestyle factors. If you see someone who's had a myocardial infarction, the pain is indescribable.
It is. Yeah, and mental health, I mean, at any time I work in the hospital, that's over half my list. People who have really, unfortunately, fallen victim to a toxic culture where they're indoors, they're not moving, and they're just eating junk, not enough of these fruits, vegetables, antioxidants. Yeah. And nature gets you very quickly if you've moved away from it. It's a universal law of nature that the further you move away from how you're supposed to live, the more consequences, physical and mental health, you're going to feel. And it's just so sad to me that we're in a paradigm where the medical establishment as well promotes that the answer to this is more pills and injections. Yeah. It's a ludicrous vicious circle. Yeah, it's going to implode eventually. What we hope from our messaging is that more people just realize that there are other ways to improve their health and well-being, and we're not telling anyone what to do. We're not giving you medical advice. We're showing you studies like this, and then by all means make your own mind up. Whatever works for you, go ahead and do that, and do your own research too.
The other thing is interesting as well is the acute effects. I talk to quite a lot of people about nutrition and diet. It's been quite a big interest for some time now, and they tell me that if they, for example, talking to a guy recently who was working away, it meant a cooked breakfast in the hotel every morning. It meant maybe grabbing a McDonald's or something, or other burger chains were available. But he was just sort of eating quickly in between work times. And he said at the end of the week he just didn't feel as good.
Yeah.
Whereas when he was at home and he can control his own diet, he just feels better. So, eating junk food for a week, and he could really feel that he wasn't just feeling as well, tired, brain not as clear, just not bright-eyed and bushy-tailed anymore at the end of the week.
That's
because
right.
Because he wasn't controlling his diet.
Put it really well. And I've made this point in a recent video. There are literally hundreds of millions of people out there who that is their default. And they literally don't know what it's like to feel good. It's really sad. Well, we go back to when we were growing up, where we didn't have this type of paradigm. People were outdoors. We would go outside and play all day with our friends. You could leave doors open. I mean, it's not that long ago. And things have really changed and swung in a different direction. And especially when I see young people, lots of teenagers now who are in this vicious circle, they're not eating fresh food, bigger problem in America than in Europe, and they've already started on their medicines. It's absolutely terrible. It hurts me as a doctor when I see it.
Yeah, it really makes you grieve for it, doesn't it? Yeah, it's just, they've just got this amazing anatomy and physiology that in a way is just being squandered. Yeah, rather than being loved and cherished and preserved. And absolutely. Well, Sunil, thank you for that. Any last points to add to that?
No, just what we've already said. Encourage everybody to keep your mind open, realize there's amazing things in nature, and there's a compounding effect. Every little good thing you do is going to add up to massive changes. So we've done blueberries. I am waited with bated breath to find out what you talk about next, because I actually ordered this. So this is why these discussions are so good, and I'm learning as well. Aside from anyone,
well, I am. That's why I'm here. Yeah.
I got flaxseed straight after straight after we had that talk, and package arrived, and even my wife said, "What's this? What's this package?" I said, "Oh, look, flaxseed. We're going to start putting this in." So I had it in yogurt. I've been having it with other things, and I've learned something. So another tick box for me now.
And it is quite nice.
You sound like you're already doing blueberries.
Sorry, say again.
You were already doing blueberries.
I do like blueberries. I do buy them when they're available. I'm not always can't always get them, but yeah. But no, flax seeds are great. They're tasty. The microbiome, the whole thing. But couldn't agree more that it's not just one thing. So if you can't get blueberries one day, don't worry about it. Buy oranges. Or get blackberries, or pick blackberries in summer, as long as you don't pick poisonous, the wrong thing. Eat as a wider variety of things is practically possible for you in your particular situation. Now, as to my next topic, Sunil, I haven't quite decided what I'm going to do yet. It's either going to be, or there again, I might do. But I do have a couple of ideas, so I'm afraid you're just going to have to wait, my friend, as is everyone else, as are all the friends watching. Just going to have to wait. Yeah. So tune back in for the next one. That was the second in our natural medicine series. Thanks to Dr. Sunil Dand. And let's. Oh, my mind's buzzing about what I'm going to be doing next now. So I'm going to shut up now. But thank you for.
Yeah.
Thank you for watching.
Thanks for watching. Thank you.
Yeah, thank you, Sunil. Bye.